My name is Mike Lykins. I'm an orthopedic surgeon here at Spectrum Orthopaedics. This is my 25th year in practice. I've been a member of this community, Stark County, for those 25 years, raised 3 daughters. My specialties are total joints and sports medicine. I actually had a knee replacement 3 years ago. So when I talk to my patients, I can talk to them not only through an observation, I can also look at them as a former patient and help them kind of understand the process, tell them where the bumps are going to be. And I think they appreciate it. And if they don't believe me, I pull my pant leg up. I show them my incision. I'm like, hey, I've been here. I've been through the struggles. I know what you're going through. The NAVIO is a robotic assisted total joint addition to our care. We use a computer to help us develop points of references on the knee to allow us to put in the most exact balanced knee that we possibly can. And the robot part is still held by us, so we're still doing the surgery, but the robot allows us to only take off precise amounts of bone and tissue so that when we put the total joint or the partial knee in, it's exact. It just allows us to be better. When I first started back in the 80s and 90s, the life expectancy of a total joint was 10 years. Now we're putting in implants that last 20 to 30 years. The NAVIO allows us to be more precise, and if we're more precise, then that's just going to allow better wear and more longevity out of that implant. They can have pain-free activity and play tennis and light jogging and play golf and bowl and go shopping without pain and go for walks and just have a healthier lifestyle. And it's nice to be able to provide that for them. At our center, since we're only dealing with orthopedics and healthy people, we're not in a hospital where there's pneumonia and sicker people. So I think just the risk of what we call nosocomial or institution infections is below the average phenomenally. People don't want to be in the hospital. People want to have it done and be able to go home and have their own family take care of them. People go home the same day from having this surgery. I mean, I let people golf at 6 weeks. This was not heard of just 10 years ago. A long time ago, when I was a resident, an old orthopedic surgeon told me once, he said, take care of people, the rest will take care of itself. So I pride myself in being as personable as possible and treating each patient with respect, no matter what the status of that patient is. And over my career, it seemed to work out pretty well for me.